Hello, everybody, and good morning. My name is Ricardo Cabrera, and I am the operations manager at the Latino Chamber of Commerce of Boulder County. And we're back doing our bi-weekly COVID updates. As we all know, the new variant, the Delta variant for the COVID pandemic is coming back. It's gaining strength, and we are trying to prepare and preempt all of this by doing some updates and sharing information with you. I have with me today Dr. Lizbeth Mendoza from Boulder County Public Health, and she is the coordinator of the Vaccine Equity Coalition community. It's a VECC. It's called VECC. And so welcome, Doctor. How are you today? Thank you for being here.
Oh, hello. Well, thank you for having me here. I'm doing really well. Thank you.
Yeah, so COVID Vaccine Equity Coalition. So tell us briefly about the Delta variant. Why is this so contagious or scary? What's going on with this?
Okay, let me just really quickly clarify. It's Vaccine Equity Coordination Committee, because there's another coalition, so there is no confusion. But we are the Vaccine Equity Coordination Committee. Having clarified that, thank you. Well, so the Delta variant is really a variant that we are concerned about. It's a variant of concern because different from other variants where we always concerned about variants, but this one in particular is what we're seeing in pretty much all the cases of COVID cases nowadays in Colorado. So that means that it's really penetrated in the community that is sick, of course, and of course in the community, because the cases are only based on who get tested for that. So, but then it makes us think about the community. This is a spread everywhere, this Delta variant. This Delta variant is 2 to 3 times more transmissible than the other type of a strain that we had the last summer. So that might explain why it's so prevalent. So somebody that gets this Delta variant in their system and become infected, they will have about 1,000 more copies of the virus in the respiratory tract compared to the other variant, the one that we would call the wild type of the COVID virus. And when you catch the Delta variant, the other issue is that it's more likely to you become more likely to give it to somebody else earlier than with the other variants. So, it's not like you get it and then a few days pass and then you finally get sick and you're contagious. This one is like super fast to get contagious once you get it, and it replicates really fast. So that also explains why it's highly contagious. But we know that we can control it through the vaccination. That's for sure the critical point to end this spread of the variant, the Delta variant, is a vaccination, plus the use of the masks and the social distancing and the careful washing, cleaning your hands and surfaces and so on. So we all went through all these measurements before. So I think this is a time to just come back to them. It's okay until we have this one under control, and most importantly, getting vaccinated on top of everything.
Wow, so it sounds like it is much more contagious than before. It's also true that if you're vaccinated and you don't get sick, you can still transmit it. So you can still be a carrier and a transmitter of this disease, even though you're not getting sick, which is also another reason why it's so contagious. And also what's different, guys, about this variant is who is affecting. So if we're looking at Boulder County's public health dashboard, with statistics about, they update this every week. It's updated, and right now it shows that the age groups that are getting testing positive more in the past 7 days are 23 to 44 and 0 to 9, which is different than before. We didn't have kids getting infected at this rate in the wild. I like that, in the wild variant, the previous variant. We can also see that by cities. We can see that Boulder, the city of Boulder, has 35% of the cases. The city of Longmont has 25% of the cases, And put together, Lafayette, Louisville, and Superior have 27% of the cases, 13% for the rest of the cities in the county. And finally, right as of the past 7 days, from August 9th, we had 40 cases in 7 days, which is at par in May. And going back to September and October, we had a couple of weeks where those were the cases, the caseload of new cases per week. So let's do what we haven't done this in a long time, and remind everybody to wear a face mask, social distancing, and wash your hands. We may, if we can't control this Delta variant spread, we may have to go back to that. And as Dr. Lizbeth says, it's okay, no big deal. Let's just take care of ourselves right now and hope to stop this in its tracks. So with that, Doctor, I have a question for you. Well, besides the obvious places like hospitals, supermarkets, and medical clinics, where can I get vaccinated?
Yes, that's a question that often comes in the communities. So you can get vaccinated in these community clinics that organizations are putting together with the help of the the state of Colorado. Also, you can see the buses that the state of Colorado puts, brings with the vaccination staff and the vaccines themselves. So these are, we call them like short-term clinics. We call them that way just because they are organized, they show up for first dose, second dose, but it's not like they're always going to be there. It's just they show in different places. For instance, there is one that's been happening in the library in Longmont, and not in Longmont, in Boulder. You can see them maybe outside of CU, maybe outside in the parking lot of a restaurant, at an event, like in the future will happen with the Latino Chamber of Commerce, or other events. And school parking lots in the schools, parking lots in supermarkets, parks, even parks outside. So there's a lot of these clinics that are being supported by the state, and also Boulder County helps, starting to help with these ones. So so you can find all of these, the list of these clinics, you can find them in the website in Boulder County Public Health. And also there's with your cultural broker and your community ambassador or community partner, they have the list of detailed, details about these clinics, mostly like which kind of vaccine you can receive there, where and when, what time, all those things, if there is anything available like an incentive, etc.
Yeah, so all that information, by the way, is down here in the description. You're going to find links to the stats that I just mentioned. You're going to find links to a spreadsheet with vaccination clinics, dates, locations, times, phone numbers, and all that good stuff. So another question for you: if I have a family, so it's me and my partner, my wife, and my 2 kids, is there a place where I can go get vaccinated all at once in one time, so I don't have to be shopping around and just show up and get it all done at once?
Yeah, so the key here is, where can I find the Pfizer vaccine? That's one of the keys, because that's the vaccine that can be used in children, in children 12 and up, and obviously people 12 and up. And so anybody can receive it, including the teens. There's also, so when in any clinic that you're looking for, as long as they have Pfizer, all of you, including teenagers, can get vaccinated. Now, there's also, among certain communities, or even people that don't like injections, there are places that offer Pfizer and J&J. And J&J is that vaccine that is only 1 dose. So even if you are for it, or you have a friend that is visiting and they just want the dose because they can't come back for the second dose, well, this is a great place to even bring your friend to get vaccinated. So yeah, that we have in Boulder County Public Health in our permanent clinic in Longmont, in San Brain, on Tuesdays, Thursdays, and every other Saturday. But also in these clinics that I was mentioning, some, like Walmart and King Soopers and so on, they may offer this as well. If you get into their website, you can even make an appointment for that. And as well as hospitals and clinics, you have to ask your provider, but that's the key. As long as you find that it says Pfizer, then we can get the kiddos and everybody vaccinated. And the other detail with J&J, even Moderna is 2 doses. So if you're for it, there's clinics with Moderna as well.
Excellent. Well, this is all great information. Dr. Lizbeth. Thank you for sharing. Remember, all this information is down here. Go get vaccinated. That's really our only defense to stop this Delta variant. It is, as it happens and it's happened in the past, the way of the world goes, so does Boulder County. And around the US and globally, this Delta variant is just taking off. And it really, not to scare anybody, it's probably just a matter of time where this numbers grow in this county. And we may be too early and preempting all of this, but this is the county's and the public health department's job to be smarter than everybody else. And let's listen to what they say. Let's maybe go back to masking. I know some schools are requiring it now. Let's do social distancing as we did before, and wash our hands and take care of yourselves. So Dr. Liz, thank you for all your information. And for everybody else, thank you for being here. And until next time.
Well, thank you. Thank you so much for having me here, and well, have a great week.
We'll see you in the next 2 weeks.
See you. Bye-bye.